Thyroid surgery is probably the most common surgery in the head and neck field practiced nowadays. And the frequency, the incidence of thyroid cancer is increasing, and it's a very technical operation. And potentially there are several complications that can occur during a thyroidectomy, especially concerning the laryngeal nerves, the voice nerves, and the parathyroid glands. Also, the thyroid gland is a very well vascularized organ, so a potentially fatal complication that can occur after thyroidectomy is hematomas, postoperative hematomas. Finally, there is the scar on the neck, which usually is very aesthetic, very nice, but the surgeon has to take some measures to make it more aesthetical. So we talked about how the surgeon could avoid the appearance or try to avoid the appearance of these complications. So there are several measures that can be taken. But the most important thing for sure is the knowledge of the anatomy of the thyroid gland and of its surrounding structures. This anatomy is quite variable, especially concerning the nerve, the number of its branches, and each branch has to be carefully preserved. And the extreme variation of the parathyroid glands anatomy. The parathyroid glands are very tiny glands, small like that, 2 to 3 millimeters, usually 4, and they are 4 glands, and they are very closely attached to the posterior aspect of both thyroid lobes. And the surgeon must be very careful in order to preserve them when he or she does a thyroidectomy. So, because they control the calcium metabolism. And once they are injured or removed, the calcium levels drop dramatically, and this can lead to significant symptoms. Regarding the laryngeal nerves, recently there have been some measures, some devices that can do an objective monitoring of the laryngeal nerves during thyroid surgery. This monitoring uses special cannulas, tubes, endotracheal tubes with monitor sensors on the vocal folds, on the vocal cords, and the surgeon can actually stimulate the voice nerves during the thyroid surgery in order to assure that they are intact functionally. And this is obviously an extra measure to be safe about their action, their physiological action. Finally, there are several devices in the industry that help to seal and cut the innumerous blood vessels that come to the thyroid gland, especially in large growths, in large goiters. And this helps very much the surgeon to control the bleeding, to make a safer operation, and to leave less stitch ties within the neck of the patient. Electrical cauteries are very traditional, have been around for a long time. But more recently, there are other technologies. And my favorite one, and I have no conflicts of interest whatsoever, is the harmonic scalpel technology, which actually is not electrical, but it's a very high-speed vibration which denatures the proteins and seals the vessels, as well as this particular one that I use cuts the vessels. So it's very safe, fast, and I think it's very adequate for thyroid surgery.